Hi everyone, welcome to the YouTube channel of Swasti Vishwa Institute. I am Dr. Swati Karve, founder of Swasti Vishwa Behavioral and Social Sciences Institute Foundation, a Section 8 non-profit company started with a vision and mission to provide education, training, services and research in the areas of behavior and social sciences and mental health. Welcome everyone. April is Autism Awareness Month, and we are very happy to bring to you our conversation with Nazema Sagi, a consulting clinical psychologist who is also RCI certified. She has her practice in Mumbai and has extensive experience in the field. The aim of today's conversation is to learn more about autism. Some listeners may or may not know what autism is. Some may want to know more. So let us find out more from Nazema. Hi, Nazema. Thank you so much for accepting our invitation to do this awareness program on autism. Welcome to our YouTube channel. Now,
Thank you, ma'am. Thanks a lot for having me here.
Thank you so much. Let me introduce you to our audiences. Nazema has more than 15 years of experience in mental health and works with children and adults. She has extensively worked with children in learning disabilities, developmental disorders, and autism. She conducts assessments and provides therapy in this area. She worked with SRCC Mumbai since 2021. She is currently consulting at Prafulta Center in Andheri and Mind Wellness Center at Vadala, both in Mumbai. And she provides testing and therapy for children with various developmental conditions. She also provides counseling for parents. And apart from her practice, she is also a visiting faculty in Mumbai colleges for the MA programs in psychology. We are very fortunate to have you with us, Nazema, in this discussion about autism as we observe this Autism Awareness Month, and we are looking forward to learning a lot about this from you. So,
Thank you, ma'am.
Thank you, Nazema. So, let me start by asking, can you please tell us what autism is? Like some people know a lot about it, some people don't know about it. So, can you just let us know what it is?
So autism is not one single thing. It's a broad range of conditions. Okay, and what does it characterize? There are challenges with social skills, repetitive behaviors, speech, non-verbal communication. It looks different for everyone, and any child with autism will have his own strengths and weaknesses and challenges which they are facing. So basically, autism mainly has people with autism mainly have challenges with social skills, relating to people, challenges with communication, how they put forth their ideas, how they talk, how they interact with people. Okay, they have challenges in keeping relationships or making relationships. Then some may have restrictive or repetitive behaviors. Some may have a very fixed idea of routines or fixed set of routines which they don't change. Some may have very fixated, very specific interests in some particular areas. Some may also have sensory concerns. So it's a broad spectrum. And again, the severity also differs from person to person. Some may have it in a mild form, some may have it in a moderate form, some may have in a severe. So these are the characteristics of people with autism.
Okay, so one can say that if a person or a child is demonstrating these symptoms, typically lack of social skills, communications, repetitive behaviors, some sensory issues, and so on, then they are on somewhere on an autism spectrum, and which is different for everybody. Okay.
Yes, it's a spectrum.
Okay. So,
and no two children with autism may be the same, showing the same challenges.
Okay. So now, when does one know that their child may be having autism? Like at what age does it show up? And many parents will have this concern, like, is my child having autism? When should they really be concerned or, think about dealing with this?
So, in very young children, there are some signs which they can look out for.
Mhm.
When children are not responding to their needs, avoiding eye contact. Most children will give eye contact, okay? But when children are avoiding eye contact, not smiling when you smile at them, okay?
Mhm.
Getting very upset at certain smells or certain
Mhm.
sound or certain tastes or certain textures, the sensory issues. Some children may be showing repetitive, like flapping hands or flicking fingers or rocking their body. These kind of repetitive behaviors may be seen. Okay, not talking as much as other children.
Mhm.
No pretend play, not playing with dolls or pretend play. So pretend play, for example, I am the teacher, you're the student. So no pretend play. Or sometimes they may be repeating the same phrases over and over again, or repeating what I tell you. If I say, what is your name? Usually the answer will be the child's name. They might just repeat, what is your name?
Mhm.
So repeating the same phrases again and again. And in older children, if they're not understanding the feelings of other people, again, unusual speech, having a very strict daily routine and not wanting to change their routine at all, having very fixed interest in some particular thing, like, playing only with a particular toy,
Mhm.
or liking to do only one type of activity, or finding it hard to make friends, finding
Mhm.
it hard to understand proverbs. I'm talking about older children.
Mhm.
Okay, so these are some of the things that can be observed, which are sort of red flags saying that, okay, now we must get an assessment done. So, again, these are not diagnostic by themselves. But
Mhm.
when the parents see these kind of signs, then it is good to consult an expert, a doctor.
Okay.
You know, uh, a doctor can be your own family doctor, like a general practitioner, or
Mhm.
you can consult a developmental pediatrician, or a
Mhm.
pediatric neurologist, or a clinical psychologist dealing with neurodevelopmental problems. So then it's a good idea to go to the experts if you see some of these behaviors, uh, to get a proper diagnosis and an
Okay.
assessment.
So one question is like you said, the child may not be able to tell his or her name. Now, what age does this show up? Like, does it show up like, 1 year old, 2 years? I mean, name, of course, 1 year old cannot tell, but what
Yeah,
age do
yeah.
these
So
behaviors show up?
okay, so usually the diagnosis of autism is usually done around three
Just
years
one
or
minute,
two and a half.
if I may just interrupt you, if you can just talk a little bit louder, that may be a bit helpful, maybe
Okay,
closer
is
to the
this
mic.
better?
Yes, yes.
This is my mic wasn't full.
Yeah.
Okay, so I was saying that usually autism is diagnosed after 2.5 to 3 years.
Okay.
Okay, but some signs like what I said, so maybe if very young child are not smiling, not looking at you when you're calling them.
Hmm, hmm,
Okay.
hmm.
The younger, I'm talking about toddlers, not looking at you when you're calling them. So there are very small signs which are there. And as they grow older, then you can see more signs. So the diagnosis is usually done after 2.5 to 3 years, the formal diagnosis, but some signs may be present.
Signs may be present. So now when, for example, parents may want to know, like, there may be certain symptoms which are associated with, say, learning disability or ADHD, like,
Yeah.
and autism. I mean, so how do you kind of differentiate between these things? How do you know that it's not an LD or ADHD or
Okay.
autism?
So autism generally, as I said, is diagnosed around 3 years or so. ADHD is generally diagnosed after 3 to 4 years, and learning disability generally after 7 years. Okay, and
Oh,
what do these involve? So symptoms can be overlapping.
hmm,
Okay, so children with autism may also have learning difficulties, and they may also have ADHD at the
hmm,
same time. But the difference is that ADHD is mainly a problem with paying attention, not being able to sit in one place, that's hyperactivity, and also problems with planning, uh, executive functioning. All those things happen, which again overlap with autism, but they're distinct. A child with autism can also have a learning disability. Okay, they can also have ADHD, but they are distinct. A child with ADHD may or may not have autism, for that
Okay.
matter. But a child with learning disability may or may not have autism.
Okay, okay. So the important thing is to get the child tested first of all, so that a diagnosis is done, like a differential
Yes,
diagnosis, or
yes,
and
yes,
then get a
yes.
diagnosis of autism.
Get a
One
proper
question,
assessment from a
yeah,
professional,
from a professional. Yes, yes.
from the
One
appropriate
question
professional.
is autism related to IQ? Because a lot of times, persons or children with autism, like they get labeled sometimes as maybe intellectually
Ah,
disabled or deficient, or so. Is it related to IQ?
again, there is the, the group of people with autism, it's very heterogeneous. It's not similar. So some people may have an intellectual disability. They may have low IQ, for example. Some people may have below average. Some people may have average, and some people may even have above average IQ. So it's a whole spectrum. Similarly, the IQ is also not necessarily low or not necessarily below average. It can be average, it can be above average. That said, few children with autism do have below average or borderline function, and some may even have intellectual disability. But then it again differs from child to child. It's not necessary that if a child has autism, they will also have intellectual disability.
Okay. So you mentioned about assessments. So what are those
Yes.
different tests and assessments that you do for these children with autism? And then, at what age? So what are the the diagnostic tests?
Okay, so specific. So if an assessment has to be done specifically for autism, the autism specific assessments. One is CARS, CARS, that is Childhood Autism Rating Scale. That's a very famous and very well known assessment
Hmm.
scale. Then there is autism, and okay, what age? It's from 2 years and above. It's usually done with children, and sometimes also it has been used for adults.
So
So that is,
now,
I'm talking about one. Then there is ADIR, Autism Diagnostic Interview. That is ADOS, at Autism Diagnostic Observation Schedule. Okay, so GARS, Gilliam Autism Rating Scale, all these are there. And I would also like to say for toddlers, when we want to see if there is a risk for autism, then there is a specific instrument known as MCHAT. MCHAT, Modified Checklist for Autism in Toddlers, which just screens and says that you may be at a risk for autism. Child may be at a risk for autism.
okay.
It is, it is used for 16 to 30 months of age.
Okay, so this is very interesting. I didn't know that there was a screening test for
Yes,
autism, so
yes.
that the parents are
It's a
already
screening.
okay.
Yeah, it's screening. So,
Mhm.
then if something turns up in the screening, then a further assessment will be done. But it's a checklist for autism in toddlers.
That's very
And it
interesting
is
to
used
know.
at very low, 16 to 30 months, just to see if the child is at risk for autism.
At risk or not. Very nice to know this. So one
Yes,
of the
and
things
one more
is,
thing I want to
yeah,
say is
go ahead. Yeah.
India has developed now instruments also for
Hmm.
assessment of autism. One is Indian Scale for Assessment of Autism, ISA. It's used between 3 and 20 years of age. And there is one INCLEN, a diagnostic tool, which again AIMS Delhi has modified, and it can be used between 2 and 16 or 17 years of age. These are Indian specific instruments which are now being very widely used in along with cards.
Wow, this is really nice to know this, Nazima.
There was a
Like,
lot of work done in
it's
India on this. So yeah, these
yes,
are the two
very
instruments now.
encouraging to know this. One of the important things is, like, parents may see these behaviors in their children, they may be in denial. So, what is the need for early diagnosis? Does it make a difference?
Yes, the earlier we diagnose, the earlier the intervention can start.
Okay,
So it is useful in terms of starting the intervention as early as possible,
okay.
the therapy
And
or the treatment.
Right, right. So I was coming to that, like, what are those different options available, like treatment options, therapies? So how does the child with autism, get all this help needed from different
So when a
professionals?
child is diagnosed with autism, uh, it's not only the psychologist, but also a lot of other professionals who are in. Okay, so they may have motor difficulties and attention difficulties for which an occupational therapist will conduct occupational therapy. Then many of them have speech difficulties also.
Hmm.
So there will be speech language therapy, which is very useful for them. And then there is behavioral management therapy or applied behavior analysis, which is also very useful for these children. Okay. Then social skills training is there. Then parental counseling is very important as to how the parents are to deal with the problems that the child is facing. How what kind of behavior, what kind of parental behavior is helpful for the children in the management of their problems.
So
And there
like
are
for
various behavioral treatment approaches. Like there is
oh,
applied behavioral analysis, I told you.
hmm,
Then there is something known as PRT, pivotal response training. Okay.
okay.
Then there is social skills therapy, which is there. So, and there is something known as DIR flow time therapy. So there are many behavioral therapies which are there, to help them with their behavior.
Oh, okay. So there are a
So
lot
all
of
these traits,
options. Okay, so
yes, yes,
these
and
are
it's
very
a yeah, and it's a always a team which is ideally involved in this, consisting of the doctor or the developmental pediatrician or the pediatric neurologist, the clinical psychologist or the behavioral therapist, the occupational therapist, the speech language therapist. Sometimes they may need remedial education. Okay, if they are
hmm,
having educational problems. So then again, the remedial educator or the special educator is involved. So it's usually if there is a team, which is
hmm.
looking after the child and in all the areas, it gives us the best results.
Oh, okay. So there's a lot of support. So one of the questions that the parents, they may or may not know this also, that there are so many options available.
Yes.
So they generally, I mean, most of these children are going to say, for example, regular schools. So are schools providing any of these resources for the kids, or what do schools generally do?
So some schools are providing these services and some schools are not. There's still not many schools which are providing this, but some schools will provide these services. And
Some,
again, what school the child goes to is also dependent on a lot of other factors as well. So for example, what are the challenging behaviors? If do the challenging behaviors hinder them from sitting in a regular classroom? Do they need
hmm,
to go to a special school? Do they need to go to an inclusive school which provides supports
hmm.
for the children with autism? All this has to be kept in mind when the child goes to school.
Okay, because what I was thinking as you were speaking, and maybe parents also have this experience, that a lot of the time for the child, like with all these therapies going on, like, is the child having that time, energy, motivation to sit in a regular class and do all the therapy that is going on? So, what is your experience been like? What do parents tell you?
Yes. So for the younger children who don't have very long classroom hours or very long school hours, it's comparatively easier. Plus also the availability of service. How near is it to your home?
Hmm,
That
hmm,
is
hmm,
also very important because there are some areas where these facilities are not available and it makes it very difficult for parents to access these services.
hmm, hmm, hmm,
So
hmm.
that is one problem which is there. What was your other part of the question?
No, I mean, it's the whole thing about, managing the
Yeah, you are
school
asking
and
how to manage. Yes. The
yeah.
older children who have more of educational requirements, they do find it a little difficult. And it also depends on the frequency. How much is the frequency of the services required? Okay, so for
Okay.
example, let's say occupational therapy or behavior therapy. They may go for 1 or 2 sessions a week. The rest of the days, the therapist might train the parents on
Oh,
what is to be done at home with the child. So that is also very important for
okay.
the
So,
therapist. So,
uh,
after a few sessions, the therapist meets with the child, does a few sessions, talks with the parents, and then trains the parents to do some activities or to carry out some behavior management strategies at home. That is very, very
Okay, because I mean, I was going to ask that, and thank you for answering this, that, parents also need to be educated on the techniques for, so in Mumbai, at
yes,
least we
absolutely.
practice in Mumbai, right? So in these
Yes.
Mumbai or other cities, like, are there any support groups for parents or children, parents of children with autism? I mean, are you aware of any of such groups?
Yes, I'm aware of one or two groups right now. I do not remember
Mhm.
the names, but yes, there are support groups. But
Support
again, not
groups.
too many, and that's also in the
Okay.
bigger cities.
Hmm. Yeah, I mean, when we start talking about all these things, sometimes it comes into my mind that, in bigger cities, there are these resource issues or infrastructure. What happens in the smaller towns where, there's
Smaller towns, so
awareness
that is true.
also.
That is true. So now, what is also happening is there is a lot of some of these services are also being offered online.
Oh, okay. Okay.
Yes. So at one of the centers where I used to work, maybe the child came for a few sessions in person and then went back to their hometown or
Hmm.
wherever they were staying, and some of the therapies could be carried out online with the help of the parent. So the
Okay.
parent acts as a co-therapist.
Okay.
So
Okay.
some of the things, yes, they can be carried out online. Not everything, but some of the things, yes, online services are
Hmm.
there.
Hmm. Hmm.
But then again, also we have to see whether the parents are able to operate a device which allows them connectivity, online
Correct. Correct.
connectivity. Where they are staying, do they have internet connectivity or not?
Yeah.
That is also very important to understand. Sometimes some parents may not be knowing how to access the services. They also that
Hmm. Hmm.
like that also bit of training has to be given by the therapist.
Correct, correct. That's true. But at least there
So
are
those
options for those who can access. There are options. I'm
yes,
sure,
yes. Again,
there's so
all
much of,
services cannot be provided, but some
yeah.
yes, they can be
And I'm sure there would be some innovations which happen now, with WhatsApp and cell phones and things. Maybe there is more access somehow. Maybe it will
yes. So
happen at some
many of
point.
them will not have a computer, but now your
Yeah.
phone is enough. Your
Yeah, exactly.
smartphone is enough. So
Correct, correct.
your Zoom can be used on the phone.
Yeah. Yeah. Anything
Google
like
Meet,
WhatsApp
Zoom,
video can be used.
WhatsApp
Anything.
video. Now
Yeah,
WhatsApp video is
exactly.
also
Right.
encrypted.
Yeah,
So
yeah.
that's
Google
also
Meet and all.
say
So, one
so.
very important question, Nazima, is, some people ask, why does autism happen? Like, what are the causes? And I've also seen, like many parents that like they kind of blame themselves, the mothers especially, they'll think that they have done something because of which the child has got autism. You see, extended family also, making comments like this, that you must have done something or something is not okay. Uh, so what's the causes of autism, and what would you tell the parents or the relatives?
So, so much research has been done, but still the researchers don't know the primary causes of ASD. Okay. So, the researchers the studies suggest that a person's genes they can interact with the environment, okay, to affect the child and to affect the development in some ways that can lead to autism spectrum disorder. Okay, so nobody knows the exact causes. What is the reason? So there are some risk factors, okay,
Hmm.
which are associated with an increased likelihood of developing autism spectrum disorder. So if you have a sibling with ADHD, so if there is a little bit of genetic inheritance, having older parents, having certain genetic conditions like Down syndrome, Fragile X syndrome, having a very low birth weight. So these are risk factors. But as we know, many children who have a sibling with ADHD will not have ASD
Hmm.
themselves. So I have a sibling with ASD, but I may not have ASD.
Hmm.
Okay, so
Hmm.
many children with older parents, they do not end up developing ASD. So there
Hmm.
are some risk factors, but there are no causes known with 100% accuracy. Okay, that this is the cause of for autism spectrum disorder.
So maybe a lot more research is required in
There is
this.
still no definite cause. There are multiple
Okay.
causes which can be there.
Multiple causes which can, and therefore I'm sure that parents should not kind of blame themselves,
No,
or
no, not at
there is no need to
all.
feel
Yes,
guilty
yes.
that they have done something wrong, because I've heard these very hurtful statements that something, you must have done something wrong, and maybe when
Correct.
you're pregnant you did this or you did not do this, that's why the child is having. So all these are not really true statements. So I think parents need to just make sure that they are not blaming themselves, and
Yes, yes,
relatives also
absolutely.
should not be saying such things.
Yes, yes,
So
absolutely.
one of the things, like when we talk about autism, like is it a disorder of the nervous system, or is it what exactly happens like in autism, like uh, why is it why
So
does
it's
it
a
happen?
neurodevelopmental disorder. So neurodevelopmental disorders means something that starts from early childhood.
Okay,
It
okay.
doesn't develop all of a sudden of its own. It develops through the childhood. You can see that it develops. Okay, so that is the reason what is there, and the functioning is affected. So yes, it is related to the brain in some way, but
Hmm.
again, no specific areas are known.
Okay, okay, okay.
In with certainty, okay, this area is only involved. A lot of different. It's functional problem.
So then one more thing, like you said that the therapist can train the parents to provide therapy at home, or supportive
Yeah, support.
yeah,
The
support at
therapist does
home.
the
Right.
therapy and then trains the parents also
Yeah,
as to
yeah.
some behavior management techniques or how to handle the child, how to deal with the challenging behaviors, all those things.
Okay. So, for example, this, say, for example, the head banging, or the child may be continuously on a device, or, not giving up. So, those are the kind of, say, for example, repetitive behaviors which may be challenging. And then the therapist will
Hmm.
train the parent how to control
Yes, train
these.
the parents. Yes,
Okay,
how
okay.
to control, how to manage,
How
how
to
to work
manage.
with it, how to work
Okay.
with it,
Now,
and then also to help the parents to realize that some behaviors are not really a problem, right?
huh,
If they are
huh,
not hindering the child's functioning. So,
huh.
sometimes they are flapping their hands. If it's
Hmm.
not really affecting anything, it's okay.
Okay. So,
You don't
there's,
have to be so bothered about the small things.
okay, okay. Got it. So, the parents
So,
have to
what to work.
realize.
Huh,
Huh.
yeah.
Otherwise,
So
there
that
is
kind of.
one perception that, a lot of behaviors are repetitive and everything needs to stop. So, what you're saying is it doesn't have to be like
Yeah,
that.
yes. It doesn't, if it's not really hindering the child's work and if it is not happening so frequently, it's fine. Some
Hmm.
of the behaviors are okay.
They are
It is
okay.
just sometimes it's their coping mechanism for the children.
Oh, okay. So sometimes in a family there's like one person, one sibling with autism, another
Mm,
sibling who's normal, who doesn't have autism. So
mm,
how do parents sometimes they struggle, like when they are dealing with the two kids, the child with special needs may be getting more attention, and the child without who doesn't have any issues, I mean, they may feel
mm.
neglected, because we sometimes get clients who even express this.
Yes.
um, so what is your advice for parents, like how do they handle these two children who are different?
Okay. So one is obviously give attention to the other child also, who is a typically developing child, as we would refer to that child. Give attention to that child as well, and involve the other child when you are trying to address any behavior or trying to train the other child. Involve the other child as well, so that he or she does not feel left out of the whole process.
Hmm.
So that is one thing I would, tell the parents. Give the other child also attention. Plus, involve them in whatever activities as much as possible with the child who has autism,
Hmm, hmm, hmm.
so
So
that
they
the
also,
child does not feel left out,
and they
and he
also
feels he or she a part of the family. That
yeah, and they
I'm being.
become a bond also, like they develop a
Yes,
bond with each other.
it
Yeah.
develops a better bonding between the
Hmm,
siblings.
hmm, hmm. So sometimes, siblings, like some siblings are very supportive, but then there are, and we really have some very heartwarming stories about, siblings who who care for their autistic sibling, and there's a very loving bond. But there may be other children, who have grown up feeling that frustration, that anger, maybe guilt, like, a survivor guilt or whatever.
Yes.
So what would you advise these, especially if they're children or older, like they have already, they've grown up with a sibling like this and they're having these kind of emotions. So what would your advice be for these older children or older, even adults who have grown up with these feelings? Like what, how do they deal with this?
So you want to know how should the parents address?
Not the parents, the sibling who has, who is having such emotions that I was
Okay,
neglected.
okay, okay, okay.
Huh.
So, okay, one thing is I would advise them to have a dialogue with their parents and,
Hmm.
tell the parents that these were my feelings as I grew. And then I would also uh, ask the parents to acknowledge it. That, okay,
Okay.
he or she did feel like that. And the parents, once they acknowledge that, that's also very, acknowledge the feelings of the child that okay, the
Hmm.
child now who is a grown up, probably a grown up now, acknowledge the feelings of the child and discuss with the child the reasons what made them behave in such a way,
Okay.
and reassure them that okay, you are also equally loved, although we couldn't give you that much time, but you're equally loved. So that I would advise a dialogue between the grown up or the adolescent child and the parents, and this is what I would tell the sibling or the child, and this is what I would tell the parents.
It's a good way of, opening that dialogue. I think expressing themselves,
Dialogue is the
expressing
most
this.
important
Yeah,
thing, and openness of the parents also to hear what the child is
to
saying and not to
hear that.
dismiss it. See,
Very
no
true.
parent wants to usually discriminate between children, and
True.
what they have done is maybe it was a demand of that particular time, or they must not have realized that the child is feeling. Okay,
Right, right,
but they still it is good to acknowledge that the child did feel that way at that
right.
time, and then to explain why they did what they did, and
Mm.
also to reassure the child that okay, I know we this is what happened, but the truth is that we are equally attached to you as any of the others.
So
So
a lot of,
dialogue is very important,
very important. A lot of
along with an
parents.
acknowledgement of the other or acceptance of the other
Accept.
person's each other's feelings. So if the child is a grown up, he she can also acknowledge the parents' emotions
Huh.
and vice versa.
So, I mean, that being authentic and validating each other's feeling, I think
Right.
would
And
help
showing
a long
empathy for
way.
each
Yeah,
other. Yeah.
empathy for each other.
Empathy and trying to understand the circumstances at that
Hmm,
point of
hmm,
time, what each
correct.
of them was, what the parents were going through, what the
Going through.
sibling with autism was going through, what the typically developing child was going through. Very important.
Very important. Good advice, Nazima. Sometimes the parents and also the child, they have this expectation that the typically developing child is going to care for this autistic child for the rest of their life. So
Agreed.
is it and that also can cause some problems in some families. I'm not saying it's true for all, but
Yes.
would there be options, like is there any rehabilitation, or are there any certain any infrastructures or anything for people with autism where they can live independently, or where they can be themselves, or
Yes, yes, there are definitely. I know there is one in Mumbai, there is one in Bangalore, which has just been opened for
Mhm.
older adults with autism, where
Okay.
there might be some vocational training given, some
Hmm,
vocation
hmm,
there, depending on the ability of the person with autism.
hmm, 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 hmm.
So yes, there are centers, but as far as I know, again, they are in the bigger cities. So,
Bigger
they would
cities,
like
yeah, I
someone
think.
staying in another town would have to get the
Hmm.
person there.
Hmm.
Again, there are also costs involved.
Hmm.
There
Correct,
is a cost
correct,
involved.
correct,
Who is going to bear the cost?
correct, correct, correct.
So again, I would say a dialogue between the parents who are there and the sibling to discuss the future, to plan for the future is very important.
Hmm. 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 Hmm.
Uh, you know, And again, how to plan for the future depends on the autism, on the type of autism, or the
Right.
severity, or the
Correct.
symptoms that the
Yeah.
child is showing. So it is
So,
very important for the parents to have long-term planning, not only planning for therapy. Financial planning is also very important.
hmm.
How they are going to, who is going to be involved,
Correct.
when the parents are, uh, they are a little older, or
Hmm.
when they
Hmm.
are not there. So
Hmm.
financial planning is also very
Good. So these are some of the things that parents have to, and I think a lot of anxiety will reduce if parents have thought about it, planned for it, and
yes, yes, yes,
they're
yes.
prepared for it basically instead
Yeah,
of
and there are
denying. Yeah,
organizations. Yeah,
exactly. Instead of denying this and not talking about it and
not
pushing it into the future, sometimes I think it could be a very important way of for them also to handle that anxiety. So.
absolutely, absolutely. There are some organizations, which help uh, the, the families. They connect them to maybe a lawyer who will help with financial planning,
Hmm,
or
hmm, hmm.
somebody. There are people who do provide these services.
Okay, okay. Good to know. And maybe, if we know some of these resources, maybe in our YouTube channel, we can later on put
Yes,
these
yes, definitely. What
resources,
I will try to is to put
yeah,
together
if,
some of these resources,
yeah,
names
maybe
of these
resources. Yeah,
organizations, and maybe
exactly.
document.
Now, one question relates to the extended families because children with autism or persons with autism, and the extended families also don't know how to behave with them. They don't know what to do when they're inviting them as guests at home, and the child goes with them. They don't know what to say, how to say. It can be a little awkward. It can be a little hurtful. So, what would your advice be for these extended families, the aunts, uncles? Grandparents.
So, first of all, it would be really good if the parents informed them about the extended family,
Hmm, hmm,
instead of like, trying to hide it or something. Uh,
hmm.
so just inform them that the child, again, that is also a very difficult thing, okay, because there's a lot of stigma attached to it.
Ah,
So, parents may not want to talk about it. But if the child is going to be in situations where they are going to be interacting with the extended family, and if they foresee any challenges during that interaction in a social gathering, in a family
hmm,
function, there is a wedding, there is a birthday party, whatever the occasion may be, if they foresee, now they know their child, and they know how the child may behave in such situations. See, first once or twice, and they may not, but then as it goes ahead, they may realize, that
hmm,
the child may face difficulties in these type of situations. So it's better, or it's good, it's ideal to inform the other people involved
hmm, hmm,
that,
hmm.
my child is likely to have these challenges. And so, once they are informed and they understand that the child is facing these problems, they are likely to be more considerate and more understanding.
More
It is
understanding.
very important to educate the extended family also.
Yeah, I think
Otherwise, many of
psychoeducation
them
is,
would not know.
yeah,
Yes, they would.
exactly. I think
And
psychoeducation is very important,
very important.
even in
And,
these extended
point
families.
them to resources
Huh, huh, huh,
where
huh.
which they can also go through. So that is important.
Good.
So
So
that,
that's very important. Yeah. I think, because the extended family can support and harm depending on how they react to the situation. So I think it's very important that they are psychoeducated. And
very, very.
talking about education now, coming back to the schools, children with autism may face bullying in the school, and so, and again, typically in a school, what kind of a support do autistic children have? And do school boards give special concessions for them? So a little bit about the schooling aspect.
Yeah. So schooling, as we briefly touched upon earlier, some
Yeah.
schools will provide support. They are inclusive schools. So they do admit children with certain developmental conditions.
Hmm.
So some of them will also ask for or allow a shadow teacher to sit with the child.
Okay.
If the child is having difficulties, not only autism, maybe other difficulties may also be there.
Hmm. Hmm.
So there may be a shadow teacher. So a class may consist of anything from 10 to 60 students, depending on the board, the school
Hmm.
class. So someone who can also pay individual attention to the child.
Hmm.
Okay, so there is a provision of a shadow teacher, in which in most cases the parents themselves have to arrange for, but still they have that provision for allowing shadow teachers. So
Hmm.
that's one. Okay, then some schools will also have a modified syllabus for
Hmm.
children
Hmm.
with special needs.
Okay.
Special schools, maybe they're inclusive schools. So these facilities may be provided. Some schools also provide additional remedial education. Some schools will also provide occupational therapy. Some
Oh,
schools have
okay.
counselors, behavior therapists. It depends on the school. You know, some services,
Hmm.
some
Hmm.
may
Hmm.
provide some may provide the whole gamut of
Hmm.
services.
Hmm. Hmm.
So all those things are there, and depending on the intelligence of the child. So again, as I said, there is a wide
Hmm.
spectrum, even in intelligence. A
Correct.
child with
Hmm. Hmm.
autism
Hmm.
can be having intellectual disability, can have below average, can have average, can have above average functioning.
Hmm. Hmm. Hmm.
So depending on that, the schooling has to be done. Then,
Hmm.
secondly, you talked about the problem of bullying.
Hmm.
Okay, again, it is very difficult because sometimes a child with autism may stand out,
Hmm.
especially if he's going to a regular school.
Hmm.
Okay,
Hmm.
where they are typically developing. So his behavior may stand out, which may lead to bullying by the classmates or the school. So again, how to deal? One is to sensitize the teachers and the school that
Hmm. Hmm.
the child has some difficulties. To sensitize the classmates also
Hmm. Hmm. Hmm.
that there are
Hmm.
some
Hmm.
children amongst you who have certain difficulties, and uh, bullying them is really very harmful to them.
Hmm.
So
Hmm. Hmm.
sensitizing the children. Then also therapy with the child who has autism who is being bullied. Okay,
Okay.
how to handle himself, how to handle the other children who are bullying him. Okay,
Okay.
what are the steps that he or she can take? So
Hmm. Hmm.
again, a lot of people, a lot of stakeholders, a lot of people who are involved in this,
Hmm.
and it has to be addressed in all these areas.
Yeah, I think a lot needs to be done in terms of sensitizing. I think, and
Yeah,
generally,
so
even the schools
sensitizing
probably
the
should.
school
Yeah,
as a whole, the school teachers,
right.
even the students of the class,
Yeah, yeah,
because even the children may not be aware,
exactly,
that
exactly.
such difficult, they may not have seen anybody with such a difficulty probably before. So
Yeah,
for to sensitize them also, to have them understand that some children can have difficulty.
yeah. And
So
I
that is
think
also very
it's also very important for parents, the school, and everybody to know that these children with autism do have certain skills. They may even have some special skills.
absolutely.
So to
Yes,
hone
yes.
those skills, and maybe they're very good at something. So just to make sure that that is reinforced and also brought out into the open, because of their autism should not define them. It's
Yes,
who
yes,
they are as a
absolutely.
person that should be expressed, and probably the schools can be a starting point for that, recognizing the individual talent that this child
The
maybe have,
abilities of the child, what they are.
abilities, and rewarding the child for those abilities and something that they can do really well, right? So the other
That's
thing
true.
is, like, what do you have suggestions for self care for parents or people who are caring for people with persons or children with autism, because it can be very anxiety provoking. It's a day to day thing. The parents have to
Yes,
do a lot in terms of, say, therapy or support. So
yes,
what
yes,
would their self care be like? How can they structure their day or time? Any suggestions for them?
yes. So what you're saying is very true. Parents or caregivers of children with autism, again, depending on the severity, some children may need very few sessions of therapy, or the frequency may be less. Some children may need, a lot of sessions of therapy. So it is a caregiver who faces an extra burden in
Hmm.
their life over and above being a parent, which anyway involves a lot of responsibilities. Over and above that, they have an extra responsibility for their therapies, extra responsibility for education, probably. So it is very important that the work be divided among the family members. Sometimes what
Hmm.
happens is it's only one person who has to do everything for the
Hmm.
child.
Hmm. Hmm.
Okay, in some cases it's the mother, in some cases it's the father. In Indian families, more of the times we see that the mother is, taking the child everywhere. She is doing a lot of the. So, as much as is practically possible,
Hmm.
okay, the work should be divided among the family members so that everybody has some responsibility and not only one person is saddled with the complete list. How much ever each person can do, depending on their, uh, you know, jobs or education. So, like if there's an elder sibling who has college, let's say from 9 in the morning to 6 in the evening. So obviously they are not going to be able to do
Hmm.
anything during that
Hmm.
time,
Hmm.
right? So if the father is going for a job for a fixed number of hours, so during that time they can't do it. So then it is very necessary that everybody chips in,
Okay,
and
so
not only
everybody
one.
based on their availability of their time
Yes,
can care
based
for
on the
this.
availability,
Okay,
can
yeah,
help each
yeah,
other in taking care. That is
taking
one.
care.
Secondly, self-care is important in the sense that all the people who are caregivers of the child, they need to spend some time for their own selves as well.
Hmm. Hmm. Hmm.
Okay,
Hmm.
nurturing their own uh, desires and their requirements. That is also very important. And also important is if they are facing anxiety or any other mental health problems or due
Hmm.
to the circumstances which are there, they should also seek help from a professional.
Yeah,
Because we have
maybe.
seen
Hmm.
some parents are, they're overwhelmed, they're very anxious, or they feel very low when some things like that happen, or due to the pressure of the caregiving,
Right,
there is too
exactly.
much work,
Hmm.
too much stress. And if they need professional help, they should not hesitate in going out and seeking it for themselves.
Yeah, and I think
Very important.
professional help does not necessarily just mean only therapy. The professionals can even guide them to resources. So guidance from
Yes, very important.
professionals, so counseling
Guidance
is
from
one thing,
professionals.
guidance. They can, the professionals can even give them a lot of avenues, resources, other than, just
Yes, yes,
probably provide therapy.
yes,
So,
yes, yes. So, if they are the sole caregiver,
yeah,
what they can do to ease their burden,
exactly.
those kind
So,
of advices can also help them. It's not just
exactly.
counseling, it's just,
Yeah.
pointing out towards resources.
And maybe even
So
things
that
like
is
the
important.
caregivers can engage in, say, mindfulness techniques and, those kind of things that calm them down. And then
Yeah,
maybe
self-care.
whatever their,
Self-care
yeah,
is very
self-care. Exactly, exactly. So, coming to the another angle of this and
okay.
just,
One
yeah.
question I haven't
Hmm.
answered as yet. What about the concessions? So,
Oh, yeah.
it- I didn't answer that because we're just talking about the school.
Yeah.
So, during exam time, for exam giving, the different boards offer different concessions. So
Hmm.
some boards may say, for example, that if a child has autism, then they have to be given a center for their exam, which is near their school.
Oh,
Okay.
okay.
Then for exams, they may provide extra time. And
Hmm.
depending on any other disability, they may even provide a writer. If they have a physical or a motor disability, they may
Hmm.
provide a writer. If there is a learning disability involved, other than uh, disability like
Hmm.
dyslexia or dysgraphia, they may provide different concessions. So different boards have different rules. But in India also now the boards have become more sensitive. The education system has become a little more sensitive, and they do provide concessions for children.
So these whatever the forms they fill, assessment reports and all, they are submitted to the school or they are submitted to the board.
So they are submitted to the school, and the school forwards them to the board.
Okay, and
So in
then
lower standards, the school themselves may take the decision, but when they're going
okay,
for board exams, it has to be forwarded to the board, and
forwarded.
each board will have its own format in which they will require
Okay, so the schools, through the
assessment to
schools,
be done.
so the assessment reports have to go to the schools and
Yes, yes.
they
And
keep. Yeah,
some schools
that's
or
good to
some
know.
boards have specific requirements also that only certain hospitals
Ah,
uh, boards they will accept. So the parents have to find out from the school
find
what
out.
is the requirement, accordingly get the assessments done.
Very good. Good to know all this so that our listeners who are interested or who want to know this, they are prepared for all these things.
And
Um,
also,
coming
there
to,
is
yeah,
now
sorry,
one more. Sorry,
yeah,
I'm
no, it's
interrupting.
just,
So there is this UDID card. Okay, there
oh,
is a
okay,
unique card for children with disability. So they
huh,
have to take the reports to the government hospitals and get a UDID card. So based on that UDID card, they get certain concessions, even in other facilities. So maybe example like travel and all.
Okay, this is interesting. I didn't know about the
Yes, yes.
UDID
So
card.
there are, yeah, there is a UDID card for
Hmm.
children or even adults.
Okay.
They can
So,
take their assessment reports to a hospital. A government hospital has to issue these UPI cards. Nobody else can issue them, and there is a certain procedure to be followed. And there are some NGOs which guide the parents also on how to go about this procedure.
okay. So there are
So
some
I will
NGOs which are
which
okay.
provide help as to अभी आप
Tell.
ये करो,
Ah,
ये form भरना है, ये करना है. So they will guide
ah,
the parents as to the process also how a UDID card can be
that's
obtained.
wonderful. Wonderful. I think if
So the
you could
government is
give
giving
us
all these
these, yeah,
facilities now.
if you give us these links, we'll put it in our channel under
Yes,
this
yes, yes,
interviews,
yes,
all the resources and things like that.
yes, yes.
You could give us resources which are there in the open this thing because I don't know if we may need to seek permission to put some resources on our
No,
site and
no.
so on.
We can
Okay.
just put the take permission and put the phone numbers of the organization. They readily
Okay.
give. They don't have
They'll
any
give.
problem.
Okay. Okay. Okay.
Give
So,
the
Anna,
names of the
yeah.
organizations who are helping the people.
Right. So I wonder, I don't know if you'd be able to tell me this or, we can just think about it. Is this UDID card or whatever, is it also useful for getting jobs somewhere? Like under the DEI, the diversity, equity,
I'm not sure
inclusion,
about that.
yeah, many companies are giving employment
Yeah,
for
because
people with autism and
people,
under the
yes, yes.
DEI
So then, yeah,
initiatives.
then probably you would need to show some report or some,
Yeah,
uh,
maybe. So,
document. But then
right.
it might definitely be useful. But I really, I'll
Oh, yeah,
check.
maybe. I mean, because you said there is a UDID card, then I was just thinking in terms of, DEI for persons with autism or other issues. And a lot of DEI initiatives are going on in Indian companies also. Global companies, of course, Indian companies that they want to employ people with
Yes,
autism, and there are certain types of jobs that are given to persons with autism,
yes,
jobs which are
yeah. Some
probably not
people, yeah,
not
some people,
customer
some sorry.
facing. Yeah, they
Yes,
are back office jobs, maybe, jobs that require some repetition or jobs which can actually make use of certain skill that this person with autism has. So I think,
yes,
there are
yes,
options and parents
yes.
can feel good about that.
And in fact, sometime back, I had read a company which had, specifically said that we are having a recruitment drive for people with disability.
Yes, yes, yes. So a lot of that is going on even in companies in India, the private sector,
Yes,
lot
yes,
of
yes.
in fact, there is one company that actually employs people with disabilities. So there are, it comes out in WhatsApp and social media that there are these very specific organizations who are employing people with special needs or autism and so on. So I think any further final words of advice for parents, thank you so much for giving us all this information. And I'm sure that parents can feel a lot hopeful that, there's a lot that is being done in this area and domain. So any final words of advice for parents of children with autism?
Okay, so what I wanted to say was that children with autism, when they grow up, it's not that they can't do any job. There are, many jobs which, as you said just now, which are not client facing, which may or may not be client facing. So, depending again on where they lie on the spectrum and
Hmm,
what are the specific challenges they have. So, like jobs like a graphic designer or
hmm,
web developer or data entry or accounting
hmm,
or lab
hmm, hmm,
technician, IT support, office admin, or office clerk. There are
hmm,
many jobs which can be done depending on the type of the challenges they face, on the
hmm.
severity. What is the severity? That kind of thing, if we keep that in mind, then we can say that there are jobs which can be done and they can be trained also.
Okay,
You know,
trained also
uh,
on these
yes,
jobs,
they
right?
can be trained. So there are again centers. which have vocational training.
Hmm, hmm, hmm. Okay.
Certain vocations they can be trained for, even if they cannot go into the regular mainstream, like
Hmm,
going to a college and getting
hmm,
a
hmm.
graduate degree. There are many people can do that as well, but if they can't do that, they can follow different vocations which are there. Vocational
Nice.
training can be given, so all that is possible.
Very nice to know, Nazima. And I think
So
in
some
today's,
professions like photography is there.
yeah, yeah,
Those kinds of professions, if they are interested and if they have an aptitude for it and they
yeah,
like doing that, so that's also possible.
absolutely. There are
That is also
options
possible.
basically. Yeah, I think
There are
just
options.
so one of the things that I think we learned from today's session is when a parent gets a diagnosis of autism or has a child with autism, uh, through good planning, yeah, planning of their care, maybe financial planning through various therapies, they can support this child. They can make sure that the future is all planned out, the anxiety can be reduced, they can take care of themselves, psychoeducate the families and siblings. I'm just summarizing everything that we spoke
Yes,
about.
yes, yes,
And
yes.
also sensitizing the school children, the other school children and classmates, making sure that the parents know about the various concessions which are being given by various
Yes,
school boards, and also keeping an eye out for various kind of jobs or vocational training that their children can undergo as they grow up. I think with all this, there's a lot of hope. There's a lot of research being done in this area, so more and
yes.
more treatments and other options will also be coming out. Obviously it's a science that's growing, so parents do have a lot of hope. And I think with that, we can end today's session.
I also want to emphasize
Yes,
one more thing.
absolutely. Yes.
Uh, Whenever you see any of the red flags, please consult a doctor. So
Yes,
early assessment, early intervention is very important. That I would
absolutely.
like to
Because
emphasize. So
absolutely.
consult your doctor or a developmental pediatrician or a pediatric neurologist or a clinical psychologist dealing. Consult someone who will help you with the
Help.
assessment and intervention.
So early diagnosis and early intervention is the bottom line, so that the developmental process starts faster,
Yes.
right?
The
Excellent. Thank
therapy, the
you. Yeah.
intervention process
Yeah.
fast as possible.
Yes. Thank you, Nazima, for this wonderful session. And thank you for accepting our invitation, for being here and sharing all your knowledge. And we look forward to more conversations with you in the future. Thank you so much.
Thank you, ma'am. Thank you, ma'am, for having me here. It was, so wonderful speaking to you about all these things. And I hope, even if some parents see this and understand the value of all these things, it would be a great thing.
Absolutely. And that's our hope. Thank you so much. Bye bye.
Thank you, ma'am. Bye bye.